Bonjour tout le monde. Good morning and welcome to this 58th edition of the André Aisenstadt Clinical Day. I'm Ernesto Schifrin. I'm the Physician-in-Chief at the Jewish General Hospital and Associate Chair of the Department of Medicine at McGill University. And it's my pleasure to open this symposium which will deal with COVID-19. The André Aisenstadt Clinical Day has been ongoing for many years, 58 years exactly, and honors individuals from the Jewish General Hospital for their achievements. It was funded by André Aisenstadt. So who was André Aisenstadt? Well, I knew André Aisenstadt in a previous life. I used to go to the country home he had donated to the Institut de Recherche Clinique de Montréal. I knew him and his wife. He was a gentleman of European origin, a mathematician who came to Montreal and made a fortune in real estate and became a philanthropist of many university and healthcare institutions here in Montreal. He donated to the Clinical Research Institute of Montreal. He donated a building for an Institute of Mathematics to the University of Montreal. And he eventually became the president of the Jewish General Hospital, and he funded, with an endowment, this clinical day. There was this story about him, and it may be apocryphal, that he had worked with Albert Einstein. And maybe he hadn't because there's some anachronism when one thinks of the dates. But be it as it may, he was greatly admired, and an evidence of his ability and his foresight is this André Aisenstadt Clinical Day. And this year, we have decided to honor the remarkable accomplishment of the Jewish General Hospital in face of the pandemic of COVID-19. And this accomplishment encompasses all levels of activity in the hospital, from physicians and nurses to purchasing and digital health and you name it. And so the committee decided to honor the leaders of those departments that participated in the response to COVID-19. And by honoring the leaders, honoring the members of those departments. So the leaders will be honored representing all the membership of their departments. I will leave it to Dr. Weiss to tell us about who will be speaking in this scientific event, in this 58th André Aisenstadt Clinical Day. But first, let me introduce to you Dr. Sam Daniel, who is the director for continuing medical education at the Federation of Medical Specialists of Quebec. Alors, il me fait grand plaisir d'introduire Dr. Sam Daniel, qui est le directeur de l'éducation médicale continue à la Fédération des médecins spécialistes du Québec, la FMSQ, qui donne l'accréditation pour l'éducation médicale continue pour cet événement scientifique. Dr. Daniel, s'il vous plaît.
Merci beaucoup, Dr. Schifrin, et félicitations pour votre super bel événement. Bravo pour l'organisation, bravo pour votre vision et bravo pour votre leadership, pour reconnaître l'excellence, le courage et le travail fort des équipes de l'hôpital général juif qui ont beaucoup donné durant une période très difficile. Alors, je vous félicite pour l'organisation de ce bel événement. Et c'est sincèrement un grand honneur et un privilège pour la direction du développement professionnel continu de la FMSQ de s'associer à la 58e journée annuelle d'André Aisenstadt. Donc, merci de nous inclure. Merci aussi de vraiment donner accès à cette journée extraordinaire à tous les membres, médecins spécialistes, médecins de famille et professionnels de la santé qui vont certainement savourer cette journée, apprendre beaucoup et vraiment voir le leadership, la vision et toute l'énergie qui a été mise à l'avant par nos personnes qui seront honorées aujourd'hui. Et quel plaisir de les voir, quel plaisir de les écouter et quel plaisir d'apprendre. J'aimerais aussi féliciter le Dr. Carl Weiss qui a co-organisé cet événement d'envergure. Dr. Weiss n'a pas besoin de présentation. C'est un ami de la Fédération des médecins spécialistes du Québec. C'était la voix rassurante qu'on entendait dans une période de détresse, dans une période de confusion, dans une période du passé qui nous a fait grandir parce que Dr. Weiss était toujours là à nous illuminer, à nous éduquer, à nous rassurer. Et c'est le président de l'Association des microbiologistes infectiologues du Québec, un vrai leader, un bâtisseur, un novateur, un pionnier et un plaisir aussi d'être présent pour l'écouter et le féliciter. Alors, je vous félicite pour votre vision encore et vous avez toute mon admiration à vous, co-organisateurs de cet événement remarquable, ainsi qu'aux leaders de l'hôpital général juif et à tous les employés de cet hôpital qui ont eu le courage, le dévouement, la passion au nom de la population du Québec, au nom de vos collègues partout dans la province. Merci du fond du cœur.
It's my pleasure now to introduce Dr. Carl Weiss, Chief of Infectious Diseases at the hospital, and as was mentioned, President of the microbiologistes et infectiologues du Québec at the Fédération de médecins spécialistes du Québec. Carl?
Alors, good morning, bonjour tout le monde. Merci beaucoup, Dr. Schifrin. Merci beaucoup, Sam. It's a great pleasure for me to be here today to talk about something very special, which is the odyssey of COVID-19. We're in 2021, and we're still talking about COVID-19. So COVID-19 obviously was and is the topic of the last year, of the last 2 years. It has changed the world. It has transformed the world. It has transformed medicine. It has transformed medicine the way we practice it. It has changed medicine the way we're going to see it in the future. And it's probably there will be a 21st century before COVID and after COVID. So in 200-300 years, when people will talk about, the way we went through this pandemic, there will be a before and after. And I think we went through all of this. I mean, we learned a lot. We made mistakes. We had to improve. We had to start doing things differently. We have to improvise. But overall, we went through it, and I think we were very successful. Today, the presentation will be on different subjects, different topics. We will talk about the epidemiology and the future of the infection. And Dr. Fishman, my colleague from Toronto, who is also in charge of the Ontario pandemic plan, is going to give his impression. And for some of you, you probably already heard him because he was part of a webinar at the FMSQ webinars last year. We will also approach the complication of COVID. COVID is a very special virus. It causes thrombosis. It causes a lot of inflammation. And one of our greatest researcher at the Jewish General, Dr. Susan Kahn, who has an international reputation, is going to talk about thrombosis and COVID-19. And as you all know, thrombosis is a major complication of COVID-19. We will also talk about psychiatry, and for a very long period of time, all the social impact and the psychological impact of COVID-19 were a little bit ignored, put on the side because the emergency was to treat patients, but there's more and more data showing that COVID-19 had a major impact socially, psychologically, and in terms of the potential psychiatric implication for many of our patients. Some data in the US showed that before COVID, about 8% of the adult US population had psychiatric issues, and in the peak of the pandemic, up to 42% of the population were complaining of intense anxiety and other potential psychiatric complications, whether it was mild or a lot more serious, but I think this is something that we will even learn more in the future. We will also discuss about COVID-19 and obstetrics, because as you know, there are many things that changed since the beginning. COVID-19 is a virus. We're always scared to see a virus during pregnancy. So how do we approach pregnant women? What do we tell them? What's going to happen in terms of vaccine? What type of vaccines, when, how many, etc. And it's a special population, but the implication on pregnancy is probably just starting right now, and we will have to learn a lot more. And we will also discuss in the last session long COVID, and it reminds me a little bit of HIV. You know, we were we didn't know a lot about HIV at the beginning of the AIDS epidemic. And now we're just starting to learn about this long COVID. It's a syndrome which has not even been characterized. Nobody really knows the consequences, how to measure it, how to make the diagnosis. We're just in a learning process here, and the future is in front of us, but we will certainly see this in a very different way a few years from now on. And finally, the keynote speaker of today will be Dr. Drew Weissman. So Dr. Weissman was a pioneer in the 90s in terms of the mRNA vaccine technology. At a time when people were not that much interested by mRNA vaccines, he started with one of his colleagues, Dr. Karinko, to think about a new way of producing vaccines for the future, whether it was in oncology or in infectious diseases. But it took a while before people started picking up on the technology. And today, Dr. Weissman has been the guest of many lectures around the world. He has been honored by many, many prizes. Some people even mention his name as a potential Nobel Prize in the future. But every time we got mRNA vaccine in our arm, we owe a little bit of this to Dr. Drew Weissman, as he was I would say, the founder and the cradle of his mRNA technology. So from this perspective, I'm sure it will be a very interesting day, and we will all learn a lot in terms of COVID-19. I have to also mention that today we're honoring many people who were working at the Jewish during this pandemic, and not just physicians. We obviously work together. Some of my colleagues are here today. Dr. Schifrin, obviously, who was a kind of a conductor of all of this in terms of the Department of Medicine, but also Dr. Mark Afilalo, who is a friend and the chief of the emergency, who worked tremendously, especially at the beginning. I remember we had very long discussion at night on the phone, trying to organize things and change things and do things our own way. And I think it helped us tremendously. But also Dr. Carmela Pepe, who's here, who was instrumental in organizing the COVID units, and others, Dr. Shami, Dr. Warshawski in the ICU, who did a tremendous job throughout the whole pandemic. But it's not just our colleagues in medicine who played a key role. I have to thank and underline the extraordinary work of people like Georges Ben-David, who in terms of organizing all the ventilation, last minute, etc., but also Khan, who is our security and who did a tremendous job, and Angelo and David, who in terms of environmental services and laundry found all kinds of things and all kinds of solutions when it was extremely difficult. and also Elliot Silverman, who was the guy behind all the logistics when everybody was trying to find masks and tests and machines. We had friends and colleagues, and everybody who was calling the hospital trying to help was channeled to Elliot, who and I can tell you and numerous like anecdotes with Elliot's. I think the most important one was when he came to me with like a swab written in Chinese, asking me if it was good or not, and I had to find my colleague, Dr. Kong, who can speak Chinese, and who was the only one who told us that it was not the swab to buy. So finally, we were all working together, and in the end, I think it made a great difference. So I would also like to thank all the physicians who were heavily involved into organizing all the services during this pandemic. Dr. Ruth Chater, who is the chief of surgery, Dr. Justin Cross, who is our digital health officer, Dr. Roberta Scheer in obstetrics, and I had many discussions, and we were texting each other all the time. And also in terms of research, Dr. Rod McGuinness, who played a very important role in setting up things at the LDI. I will also like to underline the work of Lucie Tremblay, our director of nursing, who was instrumental in organizing so many things. And when we heard, and I have to say, I shouldn't say this, but when we heard that there were many problems with nursing manpower in other places, we were not that bad here, so we had to thank Lucie for this a lot. And also mention again people like Anthony Turi. Anthony, thank you very much for all the job you did, like a tremendous job in terms of the housekeeping. David, I already mentioned David into environmental resources, and also Beverly Kravitz, who was in charge of all the legal human resources issues that obviously arose during the pandemic. So thanks very much. And now I would like to invite again Dr. Schifrin so we can unveil the plaque for the symposium. Dr. Schifrin?
The plaque bears all the names of the leaders of the different departments that participated in the remarkable response that the Jewish General Hospital gave to the COVID-19 pandemic. And it indicates that they are the honorees of the André Aisenstadt Memorial Clinical Day for the year 2021. So I'll ask now that everyone pay special attention to the video that will present the different honorees for this occasion of the 58th Clinical Day of André Aisenstadt. Thank you very much.